For today's class, we are discussing the functions of the urinary system. We'll go through each of these, but remember the primary function of the urinary system is to filter blood and create urine. Homeostasis. Homeostasis is a state of balance. It is a relative uniformity of the body's internal environment. It's the normal ranges that the body must stay in order to function properly. And the kidneys are often considered the most important homeostatic organ in the body. This is due to their ability to eliminate waste in the form of urine and also adjust fluid balance in the body. The four functions of the urinary system are excretion of waste, formation of urine, fluid and electrolyte balance, and elimination of urine. And we'll go through each of these one by one. Excretion is the process of removing waste products that contain nitrogenous waste such as urea and ammonia, which can become toxic in the body, certain salts like sodium and chloride, and excess water from the blood. When we eat and drink, the process your body uses to break down the food for energy, and this process is called metabolism, produces metabolic waste products. And these include things like urea, ammonia, creatinine, chloride, sodium, and excess water. And these things need to be removed from the body in order to keep the body functioning as it should. Urine formation begins in the glomerulus, and filtration is the first step in urine formation. Blood from the renal artery enters the glomerulus through what's called the afferent arteriole. This blood then moves through Bowman's capsule, and you have high pressure forces are going to cause excess water, waste products, and solutes. Solutes are just simply substances dissolved in blood. It's going to push those through the capillary walls. Those solutes can be things like glucose, amino acids, salts, and urea. And you want to think of those capillary walls as being like that filter to filter those substances out. And the fluid that is formed from this process is called filtrate. The next stage in the formation of urine is reabsorption. With reabsorption, you're going to reabsorb what you need and produce urine to get rid of the rest. So water and useful substances such as glucose, amino acids, vitamins, sodiums are reabsorbed as they pass through those renal tubules. The proximal tubule reabsorbs 80% of the water that's filtered out of the blood in the glomerulus. If blood levels of useful substances are high, then those substances will not be absorbed. So the body is only going to reabsorb what it needs. And understand that reabsorption is going to continue from the proximal convoluted tubule into the loop of Henle and the distal tubule as well. The last stage of urine formation is secretion. And secretion involves substances such as creatinine, potassium, hydrogen, and some drugs being secreted into the collecting tubule. So these substances are going to be secreted from these blood vessels that surround the collecting tubules. These are called peritubular capillaries, and so from those capillaries are going to secrete these substances into the collecting tubule, because these are considered waste products and toxic things that the body wants to get rid of. So it's going to secrete those into the collecting tubule. And these substances are going to combine with the other filtrate that's been formed to make urine. And understand that urine is mostly water. It's 95% water, and then it's going to be 5% of those waste products. So those waste products being things, again, like urea, salts, potassium, creatinine, hydrogen ions. So those are all considered waste products that the body needs to get rid of. The next function of the urinary system is fluid and electrolyte balance. So the kidneys help maintain fluid and electrolyte balance. And one way this is done is by chemical control. And these chemicals are called ADH, which is antidiuretic hormone, and aldosterone. So ADH, antidiuretic hormone, stimulates water to be reabsorbed. And aldosterone is going to stimulate the reabsorption of sodium. And it's going to cause the secretion of potassium and hydrogen ions. So the body is going to get rid of the electrolytes that it doesn't need. It's going to keep the electrolytes that it does need. It's going to get rid of the fluid that it doesn't need and keep the fluid that it does need in order to maintain that fluid and electrolyte balance. And this is where the play comes into, is if the levels are too low in the blood, the substances will be returned to the blood. If the levels are too high, then the substance will be excreted. They'll be gotten rid of. Okay. And just to note, a type of medication that actually inhibits the reabsorption, this medication is called a diuretic. So diuretics can exist as a medication. Diuretics can also exist naturally. There are some things that are considered to be diuretics in that they increase water output, and those can be things like, again, medications, but also alcohol and caffeine are considered to be diuretics as well, as they can inhibit water from being reabsorbed. And the last function of the urinary system is the elimination of urine. So average urinary output, meaning how much urine someone gets rid of each day, is 6 to 10 cups, which is an estimated to be 1,500 to 2,400 milliliters per day. Okay. And different things can impact urine output. So urine output can be increased from depending on how much water you drink. Also by, like we just talked about with diuretics like caffeine and alcohol, they can cause an increase in urine output. And then on the other side of that, decreased urine output, the most common cause of this would be like dehydration, so not taking in enough fluids. And some medications as well, such as certain blood pressure medicines and NSAIDs, which are non-steroidal anti-inflammatory drugs like ibuprofen. Those things can also cause a decrease in urine output. And along with understanding how much urine output is made each day, there are other things that can be detected by looking at urine. And a type of test to analyze urine is called a urinalysis. This is an examination of urine to look for things like blood cells, because blood cells should not normally be present in urine. They're going to be filtered out. Looking for bacteria, so if you were to have something like a urinary tract infection, you may have bacteria in your urine. The acidity level of your urine, which relates to pH, and other physical characteristics like whether or not your urine was a clear yellow color or if it had cloudiness. That can indicate something is going on. And so this last slide helps to give a nice overview of the path of urine. And so if we start at the top, blood is going to enter the glomerulus, which is the first step in urine formation. It's going to enter by way of the renal artery. So from the renal artery, you have this smaller vessel that stems from it called the afferent arteriole, and that afferent arteriole is going to feed into that glomerulus, which is this bundle of capillaries. And those capillaries, you can think of them as being, think of the capillary walls as having these microscopic filters, okay? And what that's going to do is it's going to filter through pressure. It's going to filter water, sugar, salts, urea, and other waste out of the blood. That fluid that's formed from that is called filtrate. That filtrate's then going to be pushed into the space at Bowman's capsule, which is just this C-shaped structure that surrounds the glomerulus. That filtrate is then going to go to the tubule system, and that tubule system consists of the proximal convoluted tubule, and convoluted just simply means bends, the loop of Henle, and the distal convoluted tubule. And what happens in these tubules is the process of reabsorption with urine. So things like water, sugar, and salts are going to be reabsorbed back into the bloodstream. Whereas other things like urea, waste, some salts, water, and acid are going to be secreted into these tubules so that it can then collect as part of that urine that's being formed. The distal convoluted tubule is going to feed into the collecting tubule. The collecting tubule is then going to move that urine to the renal pelvis, which is this funnel-shaped structure that funnels that urine to the ureters. Remember the ureters, you have two, one for each kidney. That urine is going to flow from the ureters to the urinary bladder to where it is stored until it is ready to be excreted. So from the urinary bladder, the urine is going to go to the urethra, then, which is a short tube, and then that urethra is going to feed to the urinary meatus, which is the external opening to the body, and at that point that urine is going to be expelled. And that is the path of urine formation. And this does conclude today's class on the functions of the urinary system.